All right, so let's get started. So welcome everyone, and thank you for joining us today for the KT Canada seminar series. Today we're very happy to have with us Dr. Brigitte Vachon from Université de Montréal and Dr. Sathya Karunananthan from the Bruyère Research Institute. So for the Q&A, once the presentation has concluded after approximately 40-45 minutes, if anyone has a question, please let us know by sending the question to everyone via the chat box, and I will read it out. Everyone should be muted on entry. And now I will introduce our two guest speakers for today. So Dr. Brigitte Vachon is an occupational therapist and associate professor at the School of Rehabilitation in the Faculty of Medicine at the Université de Montréal. She is a researcher at the Centre de Recherche du CIUS de l'Est de Montréal, as well as an associate researcher at the CIS Laval. Her research activities focus on the continuous quality improvement of primary care and rehabilitation services offered to people with chronic conditions. She is particularly interested in the evaluation of knowledge translation strategies based on reflexive and collaborative learning processes. Dr. Sathya Karunananthan holds a PhD in epidemiology from McGill University. As a postdoctoral fellow at the Bruyère Research Institute, she is conducting work in the areas of frailty and physical function in older persons and the role of technology in improving access to healthcare. She is also involved in projects on systematic review methodology, meta-research, and healthcare knowledge translation. Her recent work includes the development of guidance for when to replicate systematic reviews. So thank you all for being here today, and I will pass it over to our presenters.
So thank you very much for being here today. It's a pleasure, I think, for Sathya and I to be able to share the work that we've been conducting during the last few years on the subject of replication research with our two research teams. So just to acknowledge that we've received funding for our both projects by CIHR to do this research. So the objective of our presentation today will try to make you more aware of what replication research is. So we'll try to understand together what is and what is not replication research. We'll present also on how to recognize barriers to replication research and try to understand what strategies we can use to increase replication research, and also identify when systematic review replication is useful and when it is wasteful. So when should we be conducting or not replication of a systematic review? So what is the problem with replication, or what is it? Why is it an important subject? Well, we've known from the last 20, 30 years that there's been talking about in the field of research how there is a lack of research being conducted. So this has been documented in different research that have been done in different research fields, where they've identified that there is not much replication being done. So this leads to overconfidence in single study results, which was reported by John Ioannidis in a very famous paper, which means that this has an impact on reliability and validity of research findings, because we also know that there's a lack of reproducibility of research finding. And this was also confirmed in some study where for example, in the field of psychology, there was a group who tried to replicate the result of 100 original study, and they found that it was very difficult to reproduce these results, or that the effect size of the replication study was really lower than the one of the original study. So this confirms that there needs to be more replication being conducted in our research field. So our team was interested in first trying to do a study where we would clarify the definition of the concept of replication research. So this work was done in close collaboration with Janet Curran from Dalhousie University and with Jeremy Grimshaw and with all our large research teams. You see the name of all the co-authors on this project. So what did we decide to do first? So the rationale of this first study that we decided to do was we decided to do a concept analysis on the subject of replication because we noticed in the literature that replication was not well defined conceptually or methodologically, nor in research textbooks. So you can try to find, it's very rare to find a chapter in a research textbook that addresses the subject of replication research. We also found that there was confusion in the literature as what should be considered replication study or not. And original studies are really rarely replicated in a manner that can allow for the development of credible, valid, and generalizable empirical evidence. So we thought that it was important to really at first try to clarify this concept to make it clearer. So we decided to do this concept analysis of the literature on replication research. So in order to do that, we used the approach that was recommended, proposed by Walker and Arendt. The concept analysis approach is composed of 8 steps that you can see here. This is a very interesting approach that can allow you to really develop a sound definition of the concept because each step allows you to increase your understanding of the different components of the concept and helped us to gather all the information that was available in the literature. However, we know that the concept analysis approach has been criticized because it doesn't provide clear guidance to conduct a systematic review of the literature. So we combine the concept analysis approach with the meta-narrative review approach that was proposed by Greenhalgh in order to help us to gather the information that was available on the subject of replication in the literature. And the meta-narrative review approach was a really relevant approach for the subject we were trying to understand because this approach is based on a historical perspective. So it allows us to look at the literature that was published for many years on the subject and to try to see if there was an evolution in the different perspective. It also helped us to compare the literature from different disciplinary fields, so from different research tradition, and this was very interesting also to have this perspective and look at if the knowledge developed differently in those different research traditions. And also, it uses the principle of interpretativist analysis. So it helps us really analyze the data in order to identify similarities, commonalities between these different disciplinary fields, and to identify also when there was really differences between different authors' perspective, which allowed us to um, achieve and have a really good understanding of the different perspective of replication research that were out there in the literature. So what did we do for our methodology? So we conducted a search strategy. So our search strategy was developed based on first on 5 models papers that we had identified to develop the protocol of the meta-narrative review that came from different disciplinary fields. And we did a search in really multiple database. And our inclusion criteria for including a study was that it required to provide a clear definition of what was replication research, or one of its surrogate terms. And it required also to describe assumption related to the use of replication research. So we mapped all the papers that we found based on their disciplines, years of publication, journal titles, and type of publication. Then for the data extraction process, we use the different steps proposed in the concept analysis in order to extract the data from the different papers. And then this extraction was also performed based on each disciplinary field. So we created a table for the results in each of these fields, and this helped us to do the comparison and conduct the analysis where we were looking at similarities, differences, conflicting perspective between different authors in order to achieve a really good understanding of what was replication research. We also had 3 consensus meetings with our research team in order to discuss the methodology that we use at first, and then discuss the preliminary results and final results, and synthesize together the data that we had found. So our results, there was 153 papers that were included in this meta-narrative review. So most of the papers that we included were conceptual papers. We also had editorials, but we also had studies that were studying, for example, the amount of replication studies being conducted in different disciplinary fields. So most of the papers that we found were in the health field, psychology, social science, but we also found very interesting paper in the business and education field. So these papers were published between 1950 and 2008. What was interesting to identify was that most paper published in social science were published in the 90s, but in the health field, it was more at the beginning of the 2000, between 2000 and 2010, and in psychology in after 2010. We also saw an increased interest for the subject for replication research in the literature, with more publications appearing with time. And this can also be explained with the replication crisis that was major authors started talking about since 2010. So maybe before we go into the definition, it may be important to right away make the difference between what is replication research and what are other concepts that we find in the literature. So you see here, we've identified some other concepts, like for example, people are going to talk about repetition, duplication, or reproduction of research. These are not synonymous of replication research, but as you will see while I will be presenting our definition, that they are more related to a specific type or specific kind of replication study. There's another word that's very often used to talk about replication, or that is sometimes used as synonymous, but which probably we can make a big difference, is reproducibility. So what we will see is that reproducibility of research finding is more related to the outcome of a replication study. So where we will assess if we were able to reproduce or not the research finding of an index or a previous original study. So what did we find in the literature? We found that there was really multiple authors using different definition of replication research, and we didn't find really a big difference between different research field, but we found that the researcher made different use of the concept. Some had a more narrow definition of replication, whereas other had a really more broad definition of the concept. So we found that one of the use of replication was as being replication as the repetition of a previous study. So this is when people say that replication is used to check the reproducibility of research finding and to assess or test how the results have been affected by validity threats or generalizability within the same population or context as the original study. Another use of replication is when we conduct a replication study as an extension of a previous study. So this means that a replication study will be conducted in order to see to assess the external generalizability of research finding. So, and where we would make minor or more important changes to the original or index study. Some authors will also say that there is that there's another use of replication, that you can use it as the road testing of a theory. So this is when you would be conducting a replication, making really a different study, but in order to test if the result of the original or index study can stand as general principle. So what was very interesting in the results that we found was also that we were able to identify what were the attributes of replication research. So this means that when you conduct a replication study, you would be able to characterize your replication study based on these attributes. So for example, the first attribute of a replication study could be the amount of planning of the replication study. So we think that actually when you replicate an index or um, an original study, this should be a planned process, meaning that you should know for what purpose and which way you're going to replicate this index study. We also found in the literature that the distance between the investigator can be an important attribute. So it doesn't mean that the replication study has to be performed by other investigator or other research team, but many authors reported that if the replication is being conducted by independent investigator or the researcher, it would provide, it would help for the validity and credibility of the research finding. Also, another attribute of a replication study would be the similarity between the research question or the hypothesis. So a replication study could ask, for example, exactly the same question as the index or original study, or modify or want to test a similar or different hypothesis. And the fourth attribute of a replication study would be the compliance of the method. So a researcher could be conducting a replication study using exactly the same method as the previous study, or make some changes in order, for example, if there was some weakness reported in the methods of the original study, they may want to improve this and make some changes. Or if they want to do, for example, like I was explaining before, an extension of the study, make some modification to the methods in order to test these different research questions or hypotheses. So for example, if someone wishes to conduct a strict replication or a repetition of a previous study, we could think that this would be really a planned replication that would be conducted with, for example, another research team, and the research question or hypothesis would be identical to the previous study, and they would use exactly the same methods. So another aspect that is very important for replication study is the interpretation or the outcome of the research study. So this was reported often as one difficulty uh, that often researchers don't know how to interpret the result of the replication study. So this is where we talk about reproducibility of research finding. So very interestingly, the interpretation of the result of a replication study will vary depending on if the study was very similar to the original study, or if it was different in terms of the research question that was asked, or different in terms of the methods that was used. So for example, if you are successful at if you do a replication study, which is very similar to the original study, and you are successful at reproducing these results, this will strengthen like the reliability or the confidence we have in the study results. But however, this will not bring new information or new knowledge. Whereas if someone um, is successful at replicating a research study and use a different approach, like for example, use the wants to make an extension and made changes to the research study, and we can now, for example, understand how the study results can generalize to another context or another population. Well, this will also improve, bring new knowledge, and also improve the validity of the research findings. So what we were able to do with our results was also that we have found in the literature that there was multiple typologies of replication research. So we found the 32 labels of replication types, and we analyzed all this, and we were able to develop a framework which can help researchers when they want to plan or conduct a replication study. So this framework was developed and informed also by Shadish, Cook, and Campbell. They're the domains for drawing generalized conclusion about causal connection. So we are actually working on this paper that will describe this framework, but I think it will be very interesting for people who want to plan a replication study. And so at first, the researcher can first question why they want to replicate an original study, and based on their purpose, they can identify what type of replication they want to conduct. So in the end of this project, we were able to achieve and come to a definition of replication research. So what is important to remember is that what the characteristics of what should be a replication research is that it should be a study that is similar to an earlier one, methodologically or conceptually. It should be a deliberate replication of this study in part or in whole, and it should help broaden the scope of the finding of this previous study, and the importance of the different characteristics in terms of the amount of planning of the study, the distance between the investigator, and the similarity between the research questions. So Sathya, I will let you share your screen.
Thank you, Brigitte. So I'm just going to take this talk to you, I guess, about replication, but specifically building on some of the work Brigitte and the team did and applying this to the context of systematic reviews. So very quickly, systematic review is a synthesis of all the empirical evidence, and it uses explicit and systematic methods. So this is the definition taken from Cochrane. So why should systematic reviews be replicated? Well, Brigitte has given a very compelling, I think, presentation of reasons why we should replicate. It's an element, it's a core element of the scientific method, and so one would consider then that all systematic reviews perhaps should be replicated before being used for practice or policy. And we know, as Brigitte pointed out, that often times systematic reviews that have been published even in leading journals have not led to the same findings when they were replicated. And Wanis and his colleagues in the 1980s, so in the early days of systematic reviews, pointed out that there were several, and they point to 9 judgment decisions that are to be made in the conduct of systematic reviews before statistics are applied in the meta-analysis. And, you know, several decades later today, we know even with the advancement of statistical methods and systematic reviews that, in fact, even in the application of statistical methods, there are judgment calls to be made, which could impact the findings. And so all very good reasons for why one would want systematic review to be replicated. Why then should systematic reviews not be replicated? Well, I think we all know too well that there are limits to the resources available in people and in money. And if we are replicating every systematic review, we are taking away resources from potential new reviews. And then specifically in the world of systematic reviews, there's a problem of irresponsible duplication, which is an important source of research waste. So John Ioannidis, that Brigitte referred to in her presentation earlier, also published on the mass production of redundant, misleading, and conflicted systematic reviews and meta-analysis. So the graph on the left basically presents, you know, the explosion in the number of systematic reviews over just under 20 years. And the pie chart indicates, according to his classification, that only a very, very small proportion of these systematic reviews are actually conducted well and are useful. So he says, you know, 3% in the sample that he looked at. And then just linking this to the current pandemic, We know that hydroxychloroquine seemed like a very promising intervention for prevention as well as treatment of COVID in the early days, but within a few months was then found to not actually be effective. But as of yesterday, if you do a PubMed search on hydroxychloroquine and COVID and limit to systematic reviews, there are actually 93 publications that come out. And we know also that there are several other basic questions related to COVID that have still not been addressed as systematic reviews. So certainly there's a problem in terms of how many reviews are being conducted in certain areas. So the aim of our project then, and this was, a large collaborative project led by Peter Tugwell, Vivian Welch, and myself, with a large team of collaborators. And our aim was really to develop guidance on when to replicate and when not to replicate systematic reviews using an evidence-driven, transparent process with consensus approaches. So this is how, this is just an overall overview of our research methods. We used here on the left a systematic review of publications on when to and when not to replicate, and then also a study of discordant systematic reviews. And then there was an opinion gathering stage of this, which involved interviews and an online survey. And all of this information was then synthesized and presented at a consensus meeting to develop a checklist. So in the early stages of this work, and building again on the work that Brigitte presented earlier, it became clear that we needed to define what replication was in the context of systematic reviews. And so through our stakeholder interviews, we came up with these two types of replication as most valuable for systematic reviews. The first is direct replication. So this involves purposefully repeating the same methods to verify whether whether we come to the same findings. So repetition of a previous systematic reviews, as Brigitte mentioned earlier, and then conceptual replication, which is purposefully extending or narrowing a systematic review to a broader or more focused question. And this across populations, intervention types, settings, outcomes, or study design. So this would be the replication as an extension of a previous systematic review. Now, in the context of systematic reviews, it's also important to distinguish replication from updates. And so updates are typically done and quite frequently done in systematic reviews when once it's published, authors want to include new primary studies that might have been published after the systematic review to see whether that, to incorporate that into the synthesis. So they'll go back later and include the newer studies and update their systematic review. So it involves new searches, often new data, but using the same research question. And it may not uncover errors or address uncertainties or controversies related to that initial systematic review. So replication, on the other hand, it really aims to address the uncertainties, and it may or may not include new data. So there's some overlap, but they're not equivalent. So here's a summary of the methods and results that we obtained in the first stages of our work. So with the key informant interviews, we interviewed 28 key informants, and these were authors of systematic reviews, methodologists, commissioners, funders, journal editors, and users, so including clinicians and patient partners. And that generated a list of 18 criteria for when to and 6 criteria for when not to replicate systematic reviews. Then we also conducted a literature review. We identified 51 publications and extracted criteria for when to and when not to. And the most commonly cited criteria were discordance in review findings, inadequate data sources, and inadequate methods. And then we went on to synthesize this information and conduct an online survey. We surveyed 160 participants on their agreement on the criteria we had, as well as their comments. And we got fairly good agreement on the criteria that were being proposed. So all this information then was presented at a consensus meeting, including all these individuals in Wakefield, Canada, about 2 years ago now. And so there was discussion about how to use that information to develop a checklist. And one of the points of agreement was then to come up with a checklist that wouldn't be a detailed list of criteria, but rather cues to help help users determine whether a replication of a systematic review was appropriate or not. And so this was published last year in the BMJ. And this is the final checklist that was proposed. So the first question is, has the priority of the replication been assessed as high? So this is where you would typically involve your stakeholders. And then the second question is the replication likely to address uncertainties, controversies, or the need for additional evidence related to the framing of the question, the conduct and reporting of previous reviews, author influence or conflicts of interest, or discordant findings. So we want to know then whether by conducting a replication, we might reduce uncertainty. The third question is about whether implementation of the findings of the replication are likely to have potentially important, sizable benefit or harm. Or affect a sizable population. And then the final question is about opportunity costs. So are resources best spent on replication rather than on an alternative systematic review? So here's an example of how that would work, and I'll go through this fairly quickly just to give you a sense. So the first column on deworming was a Cochrane review that created a lot of controversy. It concluded that deworming wasn't really effective and not justified. And so, if we went through the checklist then, the first question is it high priority? Well, yes. The WHO wanted to know whether they should continue deworming, and people were reacting very strongly against the Cochrane review. So there were still some questions to be answered. Would the question, second item, would there be change in uncertainty from replication? Again, yes. The criticisms about the existing review specifically targeted the question of the review, the way it had been framed, and the conduct, and those could be addressed through a replication. The third question, replication findings will have an important effect. Again, yes. If a replication concluded that deworming should be stopped, then that would lead to important savings that could be transferred to other programs. And then were resources best spent on replication? Again, yes. Because the potential benefits of addressing the uncertainties around the benefits were fairly high. If we compare this to a systematic review on strategies to increase ownership and use of bed nets to prevent malaria, so that was a systematic review that was published, and basically the concern was that the findings weren't really being implemented. And so the first question about whether this should be replicated, is it high priority? No, because there was no demand for further evidence. The issues around implication were separate from the findings of the systematic review. Would there be expected change in uncertainty? Again, no, there were no concerns raised about the way that initial systematic review had been conducted. Were replication findings likely to have an important effect? No, the findings were very clear that it would be that bed nets were effective, and strategies to increase use and ownership have small effects and not expected to change replication with replication. And finally, the opportunity cost, well, it would not cost very much to replicate, but also the benefits would be negligible. So there was no real justification for replicating this one. So using this checklist, then we wanted to go a little further and think of a framework for how it would guide authors then on how to conduct a systematic review replication. And so this is where we went into more details on the second question of how a replication addresses uncertainty, and expanded on that to develop this framework. And this is still a work in progress, so certainly very happy to get input on this. But basically there are 6 stages that are being proposed for replication, for the replication framework, starting with so credibility concerns, really first identifying what is it that in a systematic review that is of concern that would trigger a replication. Next is the procedural issue. So relating to the credibility concern, what is the procedural issue in the systematic review that that would lead to that concern? And then the threat to validity. So what threat would that bring about? And then the potential mechanism. So how does that operationalize in the systematic review to create a threat? And then evaluation of the threat and replication response. I'm going to walk through these stages with an example to see how it can be applied, and hopefully that'll clarify how this works. So here's the example we're using is systematic review on prophylactic vaccination against HPV to prevent cervical cancer and its precursors. So this systematic review included 26 trials, so 73,000 plus participants, and essentially concluded that there is high certainty evidence that HPV vaccines protect against cervical precancer in adolescent girls and women between the ages of 15 and 26. It also suggested that the vaccines don't increase the risk of serious adverse events, miscarriage or pregnancy termination, and then that there's limited data for the effect of vaccines on deaths, stillbirths, and babies born with malformations. So shortly after this was published, there was a critique of the systematic review published and got quite a bit of attention. And one of the main criticisms of the review was that rather than the 26 trials that were included, they could have included 46 completed and eligible trials, and that would have been 121,000 participants, and therefore they say that the risk of reporting bias was in fact potentially high in the original systematic review. So given the level of attention and the controversies this created, there was fairly good reason to replicate it. And so I'll just walk you through the stages of the framework to see how one would go about applying it in this particular example. So the first stage then is identifying the credibility concern. And here's a list of possible credibility concerns that we generated, some relating to the framing of the question, some relating to the actual methods, and some relating to the interpretation of the findings or the conclusions that don't match the results. So in this particular example, it's the one highlighted in red. That's the concern. It's that the review does not include all relevant studies. This is in fact a fairly common concern that's raised with systematic reviews when they're criticized. So the next step then is identifying the procedural issue. If the concern is related to the relevant studies included, then the procedural issue is usually about exclusion criteria, the search strategy, or the screening process that would have led to the exclusion of some relevant studies. So in this particular example, the original systematic review was limited to published studies, and that's why it didn't include many of the studies that were cited by the group that criticized it. So moving on then to the threats to validity. So this again, we used, as Brigitte mentioned in her presentation, the Shadish, Cook, and Campbell threats. So internal validity, statistical conclusion validity, external validity, and construct validity. And we try to identify where the major concerns are or where the minor concerns are. And in this case, the one highlighted in red is statistical conclusion validity, because that's the main concern if a large amount of relevant data is excluded. The fourth stage then is identifying the potential mechanism. So in this case, if we've excluded a large proportion of relevant data, the concern is that if there are substantive differences between the published and the unpublished study, that could lead to a biased estimate of the association. So what's often referred to as publication bias. And so that's what the potential mechanism would be. And then the stage where there's evaluation of threat, you would then go on to say, how would we evaluate whether that's really a concern to the validity of the existing study? So in the original study, they could have used diagnostics to test whether there's potential publication bias, and that may indicate that there is. But even if that doesn't, in this case, indicate that there's a potential for publication bias, you could conduct further evaluation. So just search for the unpublished trials and assess the volume of unpublished literature and the potential impact on the review findings. So that would allow you to evaluate to some degree what the impact would be of excluding those studies. And then finally, the replication response. So if you do identify studies that have been excluded that could impact the validity of the original study findings, then you conduct a search, select the relevant studies, extract data of the unpublished studies, and reanalyze the data with the enhanced data set. So in this example, the group from Cochrane and the original authors went back and did do a search and identified a few studies. They didn't identify the number that the original authors had suggested were missing, but they identified some. And so they included those in their reanalysis and concluded that the addition of these data makes little or no difference to the findings of the review for the main outcomes. So this is sort of a simple example of how the framework would work, but basically the idea of the checklist and of the framework are to provide a structured approach to support purposeful replication and provide guidance to authors, commissioners, funders, and users of systematic reviews. And the hope is that this will contribute towards eliminating waste by encouraging well-justified replications that contribute to reducing uncertainties, and will also increase efficiency. So in the example that I provided with the HPV vaccine, the replication was limited to a partial replication. It didn't require a complete replication. So with limited resources, they were able to address some of the uncertainties. I'm going to hand it back to you, Brigitte.
Okay, so there's only a few minutes left. So we just wanted also to let you know that we've also did a study in order to understand better what are the barriers and strategy to improve the use of replication in research. So even for conducting systematic reviews or replicating index or original study. It was interesting while we did the meta-narrative review, we did a secondary analysis of the data that we extracted in order to understand better why it's been 30 years that people are advocating for more replication research, and this is not really happening. So maybe I'll pass on the methodology to go straight to the results, but what we found was we used a theoretical domain framework to organize the barriers into categories, but we really found that there was a lack of knowledge from researchers, editors, and funders in order to really have clear opportunities for researchers to do replication studies. So there needs to be more conceptual clarity about what is replication and a clearer of understanding of what it is. But one other interesting thing was the misinterpretation that we have in research about the concept of originality, which often seems to mean to do research on another subject as another researcher, or to do a new original study instead of considering at making an original contribution to the development of knowledge. We also identified that there was a lack of skills in order to know how to design a replication study. And as we mentioned before, how do you interpret the results of a replication study? So this would be important to improve. And also from the editors, when someone submits for publication a paper, there was authors that wrote on replication often said that editors lack skills to review and evaluate the quality of replication study. And an important thing that we found was that there's a lot of factors that were barriers to conducting replication research who were related to social influence or values that are embedded into the research culture. So as you see, some researchers will have beliefs about the consequences of what would happen if they do a replication, and that their study wouldn't be published in a research journal, or that it could even impute their reputation of they would be scared of exposing original studies flaws. We see also that this is also uh, people are scared that if they want to do a replication study, they won't get funding to do it, or that they won't be published when they submit their papers. And all this may be related also to some negative emotions that will not support the conduct of replication studies. So this is also really probably related to the environmental context, where there is a lack of opportunities and conditions for researchers to do replication research. So there is no policy available, and often the poor reporting of original study research methodology will impede the possibility of doing a replication. So, and there's a lack of system for facilitating data sharing or data archiving that would facilitate the conduct of replication, and lack of funding for doing replication. So because often one of the criteria for getting funding is originality. So rarely researcher will apply for funding for conducting a replication research. So we found in the literature really multiple strategies that could be used, that were proposed by the different authors to improve the use of replication. So I won't describe all of them, but maybe if we go to the discussion, I think what we propose in our paper is that in order to improve and increase the use of replication in research, there needs to be an important change that needs to happen at different level, and a change at the cultural level in the research culture. And where, for example, if we had advisory group that would support the use of replication and could have a good influence on funders and editors in order to promote the use of replication, the development of policies that would support data sharing, data archiving, and even conditions for funding in order that some researchers would conduct replication research. For example, the use of champions or researchers who would act as role models, where they renowned researchers who would conduct replication research themselves, who would include them in their research program, and would also train their graduate students in conducting research, and also training program for everyone, for the research community, for editors, for funders, in order to have a better understanding of what replication research is. So I hope we were able to make you more aware of this, of what replication research is and why it is important in all our field of research to improve the sound development of knowledge for all our research programs and interests, and even for the replication of systematic reviews.
Well, thank you so much, Brigitte and Sathya. So I'm going to let the audience have a chance here to ask a question or two. So please, if you have a question, please send it via the chat box, and we'll keep an eye on that. Let's see here. And in the meantime, I will just remind everyone to please, at the close of the presentation, if you can complete the online evaluation. I sent it out to everyone yesterday. And our next webinar is actually going to be on a Friday. It's going to be on March 26th with Dr. Derek Roberts. We're changing it up with our day of the week for that one. Dina says, thank you. Thanks, Dina. While we're keeping an eye on the chat box, maybe you could review for us what kind of study should not be considered as a replication?
Well, that's an interesting question, because actually, if some people are interested, there was already a paper published in the Journal of Clinical Epidemiology that's kind of a response or a critique to our concept analysis of replication. And actually, the authors provide their perspective on what is and what is not replication study. So I think what we came up to is that in order to be considered a replication study, this would mean that a researcher would deliberately take an original study and decide for what purpose and in which way is going to decide to replicate that study. So it's not something that you should find in the, you know, that like someone could do a very similar study to yours and you would find it later on in the literature, but this would not necessarily be considered a replication since it was not intentionally another study that comes from this original study. I think also some people may think that meta-analysis or systematic review may be some kind of replication, but they're not, because they're using a completely different approach to combine the results of multiple original studies. So they're not a replication of an index study in their own. Do you want to add something, Sathya?
No, I think that's good. Thanks, Brigitte. I just want to address another question raised by Stephen about the importance of systematic reviews being replicated by different authors to avoid intellectual bias. So, yeah, that's an interesting question, and certainly, I think that that's important to consider. And I think, I mean, I guess the main issue is when we're deciding to conduct the replication, if we consider what the credibility concern is, right? And certainly it has come up that the credibility concern is really about the intellectual bias, the conflict of interest, and in that case, it's absolutely appropriate and valuable for a different team to conduct it. If it's a methodological issue, it may or may not be as important. If the original authors were to address the methodological issue and be very explicit about how they did, then I think that would still possibly address the uncertainty if they're not, in conflict of interest, if that's not the concern. So I think it is definitely an important consideration, and depending on the context, may be very important.
Thank you. Excellent. Well, it looks like we are at our time. So thank you so much, Dr. Vachon and Dr. Karunananthan, for your presentation today, and thanks so much for joining us all to our audience, and I hope everyone has a wonderful rest of their day.
Thank you.
Thank you.
Thanks, Megan.
Take care.
Bye-bye.